Now, in the last hour, the Gauteng Department of Health has confirmed yet another child death due to alleged food poisoning. A grade 3 learner has died, and it's claimed that the learner and another complained of stomach cramps after eating a packet of biscuits from a local spaza shop. Well, this week, the Gauteng Department of Education said learners from a primary school in Garankua in Tshwane were rushed to a medical facility. 4 were hospitalized after they ate snacks allegedly bought from a street vendor. There was another incident reported in Winterveldt. Last week, 2 children aged 3 and 4 died after allegedly eating snacks brought from a spaza shop in Vredefort, that was in the Free State. And earlier this month, 2 grade 1 boys in Soweto died after allegedly consuming biscuits and juice from a spaza shop. So what on earth is going on? We're joined now by a panel including the National Health Department Food Control Senior Manager Penny Campbell. We're joined by the SA Informal Traders Alliance's national organizer Tusi Jackal, and in studio the spokesperson for the Gauteng Education Department, Steve Mabona. Thank you all for being with us. Steve Mabona with us in studio. Tell us about this latest incident that you've only confirmed today. It's incredible.
Definitely. Greetings to you and to all our viewers. It's quite saddening and concerning what is happening in our environment. More so where we going to have situations whereby our children are harmed and they end up dying because of food that might have been consumed. Well, we would not know confirmation thereof whether is the food or what might have transpired, but we know that the Department of Health, after admitting those children, they take necessary tests, which they will then work with the police and give them those results. The incident today, 2 children complicated while in a classroom, grade 3s, and they were rushed to a local clinic. And unfortunately, in few minutes, 1 learner, died while they're still being attended to, and the second one was then rushed to a hospital. Fortunately, the boy is stable now. We are told that he's doing well. We are very hopeful that he will come back to school soon. We are just praying for his safety.
So there was another incident in Tshwane, and that was in Garankua. So again, the pattern is that the children eat something from a vendor, a spaza shop, a hawker. So has there been an investigation there? I understand that involved quite a lot of children. So would you have one street vendor identified? Has there even been an arrest?
Yes, in the Tshwane it involves over 60 learners, over 20 from one school and just over 40 from the other school, Garankua and Winterveldt. Quite concerning. Fortunately, it's only 1 learner that was admitted. All the other learners were medically managed and they were released in the parental care. We've been then supporting the schools just to make sure that we provide necessary professional assistance, and we'll continue to monitor them. Next week, Monday, we should have our officials go back there. Yes, police have opened the case. They have confiscated the products that were consumed by children, so they will take them for necessary tests. And we are, comforted that the hospital will also, provide those tests because the results, because they have conducted tests. So we are hopeful that the authorities will then continue, investigate. But what is concerning is that this is now a norm in and around our schools, whereby street vendors or spaza shops, sell products that harm our children. So we have launched a school safety plan, 2 weeks back. So we have been saying, amongst ourselves as officials, we then need to enforce that, because now this is a challenge. We will know where to go in Tshwane, in the West Rand, and part of Soweto, just conduct an advocacy, but also target those street vendors and spaza shops that are in those areas, come with relevant authorities from municipality, from sister departments, and check if there's things that are untoward, then they must be removed from those street vendors and spaza shops.
Yeah, of course. Let me bring in Penny Campbell from National Health. Do you agree that this is becoming a norm? I mean, what is the national picture you're getting of how prevalent this is? People selling food that is dangerous and sometimes fatal for children.
Good evening to you and good evening to the viewers as well as my other panel members. Yes, from the Department of Health side, we are concerned, especially with the number of deaths that have occurred, because in the Department of Health, any preventable death is a death too many for us. So with that, we'd like to say again, condolences to all the families. And yes, we do have concerns as to what is actually happening. However, we have not found definitive links between what has happened with eating of food and whether or not what the specific poison is. Unfortunately, when deaths happen, the police have to take ownership of the cases, and we are waiting the results from them.
I remember in the listeriosis cases, you had to prove a link between a death and the exact food eaten, where it was brought from. Would you agree, Ms. Campbell, that it is sometimes difficult to make that direct link that then stands up in court and results in somebody going to jail?
Yes, that's why the diagnostics as well as the full investigation as to what was eaten and not just a specific food. We look at a whole pattern of what was eaten commonly amongst all of, for example, in the 2 outbreaks that have occurred now in the Tshwane area. The outbreak response team would go and they would interview all of the children as well as the educators in the school to understand what are the other exposures that the children might have had jointly, so that we can determine if there's a common food, and if that common food, like has been reported, is only the crisps or the biscuits or the juice, then we then can start looking at the actual juice or biscuits and try to now trace back as to whether or not that product had the same effect in the human and has the same pathogen. Now, that's usually with a foodborne illness, which is caused by a pathogen, so a microorganism. But with the first 2 deaths, we are suspecting that there is some poison that might have been consumed, because they had symptoms around organophosphate type symptoms. So whether or not that has carried across the other children, we've not been privy to that information. In the listeriosis cases, we were able to determine it because the clinical cases presented at facilities, and through the investigation of the doctor, it was then determined that these children were actually getting listeriosis. And it was then that we had to then find the common denominator as to which food could possibly causing this right across the country. And that's how we then had to, sorry?
Forgive me for interjecting. When you talk about poison in food, which is alarming, you said the first 2 cases, are you talking about the grade 2, the grade 1 boys in Soweto? Is that the incident you're referring to?
The 2 initial cases from Naledi in Soweto.
Okay. And I'd like to come back to you on that. I mean, why are people selling food that is containing poison? Let's speak to Tusi Jackal, though. I'd love a comment, Mr. Jackal. What is the response of the Informal Traders Alliance, given that there's huge concern here about what is being sold on the streets to children?
A very good afternoon to you, Francis, to the viewers of SABC and to the panelists. Thank you for the opportunity. The South African Informal Traders Alliance is representing not only its members, but every informal trader in the country. But we wish to state it categorically clear that SAITA distances itself from any wrongdoing, whether it is from our member or from the tuck shops owned by non-South Africans. We hereby condemn in the strongest terms this act of killing our innocent children, and our heartfelt condolences goes to the families of these children that are victims to this poisonous food.
Would you agree, Mr. Jackal, that there are conditions that allow this to happen? People may be wanting to make money, so they're making food in a manner that is very cheap. Everybody looking for cheap food. We know economic conditions are very hard. Children walking alone often to their schools. Do you agree that the conditions are allowing this to happen?
No, we would never, under no circumstances would we support that because of the economic circumstances. Now people must resort to cheaper and a dangerous method to make food so that they must make money at the expense of these vulnerable children. So we strongly condemn that. Look, what is concerned, what is a great concern here is the enforcement of the law. We have policies in the Department of Health in our municipalities, policies like the certificate of acceptability for the people who are dealing with food. We have all these policies in place. However, the problem is the implementation and the enforcement. Hence, people are doing as they please. I am very pleased to hear earlier on what Mr. Steve Mabona from the Department of Education advised that all stakeholders must come together to try and find an amicable and sustainable solution to this scourge, because really we cannot leave it the way it is.
I think many would concur. Ms. Campbell, do you agree? I know there's the Counterfeit Goods, the Foodstuffs Act, so there are laws in place, but he was saying the implementation thereof is completely lacking. Do you agree?
I can't say that definitively because I'm not familiar with the implementation of the legislation. But that is one of the questions that I am asking is, are the spaza shops that have been implicated, do they have certificate of acceptability? So are they known by the municipality, and have they been inspected for hygiene purposes? When you spoke also about poison being in food, remember what I said, we don't know yet if the poison was on the food or whether the children might have been in contact with it somewhere else. Because the organophosphate is all around us. We often use it to get rid of the rats in our areas. And so it might have been available there or where this food is manufactured. And this is what we don't know. Is it a product that is placed into bags by the vendors? Is it a product that is already pre-packaged? Because those would give opportunities for different types of poisoning, and we need to then unpack where the poison could have occurred from.
Thank you. I wanted to ask about that poison. So you're suggesting it's rat poison?
Well, organophosphate is used in rat poison. So it's one of it's the ingredient that kills the rat. And when you listen to the symptoms that were described by the pastor who took the gogo to church, the pastor who took the gogo to the clinic, the symptoms are indicative of something like organophosphate poisoning. Now, organophosphate poisoning organophosphates are used in insecticides, and they are often used in things like to kill rats. So they are available in our communities because we want to get rid of rats, because they are problematic in our areas. And due to that they are available. Organophosphate poisoning is most often likely to occur with farm workers because that's also an active ingredient in many of the pesticides that they use to kill insects so that our fruit and vegetables can come through without any blemishes and have a good crop from the farmers. So that is notifiable under our communicable diseases together with foodborne illness, which is the two outbreaks that are epidemiologically linked in the two incidents that have now occurred in Tshwane as well. So we have to investigate to determine what could have caused these outbreaks as well as the deaths. And we can only do that once we have the information from the police who are still investigating because of the deaths having occurred.
Mr. Mabona, does your department have any idea? Presumably, hawkers aren't trying to kill children. That would be just blatant murder. But, I mean, if you look at the Winterveldt condition, the circumstances there, I understand a lot of kids were involved and they were eating from different hawkers, something called dibombolina. So could that be one supplier? Do you have any ideas what's happening?
No, we don't have an idea, and that's why we'll leave it to the law enforcement agencies to assist us. But what we want to emphasize on is the coming together with everyone that is involved in the schooling environment, be it sister departments, like as they've already started, the outbreak team, they've been on the ground. We need to work together because now we're on the ground, we need to continue because we can then identify areas where we need to start. Conducting advocacy, but also invite other authorities to go through the schooling environment because now we know where to start.
Can I ask, have you spoken to the Department of Health and asked about these certificates that are required by law, which look at how food is handled by that specific vendor? So are you engaging with them on the implementation that the other two guests say is lacking?
No, our Department of Health is our sister department and they are our partners. We work with them every day. We are in the same cluster. So anything that we do, they will know what we are doing and they will know what they are doing. So we work together. That's why anything that happens at our school, while they are attending to it, already we are informed to say, be mindful that this is what we are doing at your school. So we'll then have our officials that work directly with the Department of Health officials. They will also be present at the school and they will plan together on what is it that we need to do. If it's advocacy that we need to implement, we'll do that. But if it's the support of the families that are affected, because there are learners that will then be medically on a continuous basis need attention. Like for instance, learners who were consuming space cookies in Soshanguve, some of them, they are still having some ailments that they're suffering from. And working with the department, we are supporting them very closely. And they will have social development, making sure that our team, because it's so overworked of the psycho support, will then dip into the social development to assist us. So we work with everyone. That's why we're saying we're going to take advantage of the plan that we have already launched on the school safety. Augment that, add some elements of moving into outside our school environment, which is the street vendors and the spaza shop. We need to go closer to them because we might say we are only securing schools, but then they play a significant role in affecting our operation because children interact with them. They get on the way and then they get sick while they are in our care. So we will then be making sure that we work very closely with everyone. And the community, we want them to support us and don't leave us. When we leave, then everything goes back to normal.
So schools should get involved, parents, the community. Let me give the last word to you, Mr. Jackal. What can informal traders do? You said you also support a lot of engagement and coming together of the various players. What can good informal traders who want to protect children do here also to protect your livelihoods?
Thank you, Francis. As I concur with Mr. Mabona to have all stakeholders come together to solve this problem, we really welcome the plan that the Department of Education is working on. And in that plan, usually there are people that are selling on the school precinct outside the yard, whereby children will be buying through the fence and so on. And that is when the opportunistic criminal elements take advantage to sell to our children poisonous and deadly stuff. So in that way, our humble plea is that for the schools, through the school governing bodies and so on, create an enabling environment for these mothers, grandmothers that are trying to put bread on the table for their children. And there must be mechanisms for regulation as to, so that when a child gets sick, we can trace back to where the child has purchased that particular thing. And as the Sister Penny is saying from the Department of Health, that let us see the source of this illness, what did the child eat and so on. And I think that is a very good initiative. Thank you.
Thank you so much for being with us, and please update us on any investigations. That was from the National Health Department Food Control Senior Manager Penny Campbell, from the SA Informal Traders Alliance, the National Organizer Tusi Jackal, and the Gauteng Education Department spokesperson Steve Mabona.